My name is Erin, and I recently completed my master's degree in the Rehabilitation Sciences program at UBC, working in Dr. Jill Zwicker's lab. Today, I will be presenting results from my thesis project, The Impact of Developmental Coordination Disorder Parent Perspectives. I would like to acknowledge that I'm giving my presentation today on the unceded and traditional territory of the Musqueam, Squamish, and Tsleil-Waututh Coast Salish people. As you are likely aware, DCD is a very common neurodevelopmental disorder affecting a child's ability to learn motor skills, and this can lead to significant functional difficulties, both at home, school, and in the community. It impacts 5 to 6% of school children, and this corresponds to roughly 1 to 2 children in every classroom. However, many healthcare professionals, educators, and parents are unaware of this condition. And as a result, DCD is underrecognized and underdiagnosed. There is no standard of care for children with DCD, nor are there consistent supports provided at school. So Dr. Zwicker and her team really wanted to change this narrative for children with DCD and their families and advocate for greater supports and services for these children. Now, we know parent voices are such an essential component for advocacy efforts. So therefore, we surveyed parents of children with DCD across the province. We launched the Impact for DCD online questionnaire to parents whose children either had a confirmed or suspect diagnosis of DCD across the province. Our objectives were threefold. Firstly, we wanted to understand how parents are navigating the healthcare and school systems when they're trying to access diagnostic and rehabilitative supports and services. Secondly, we wanted to determine which types of services and supports parents are identifying as best practice in order to meet the needs of their children and family. And thirdly, we really wanted to understand what the barriers and facilitators families are facing when they're attempting to access diagnosis and treatment for their children's challenges. So we attempted to gather parent perspectives from around the province. However, as you can see from our sample of 183 parents that responded to this question, they were primarily from Vancouver Coastal or the Fraser region. However, we did get some respondents from Vancouver Island, the interior, and the north. With regards to our sample demographics, most children were males, which is consistent with clinical samples of children with DCD. The age range spanned from 4 to 18 years, with the majority of children being in the 8 to 12 years old range. 85% of children in the study had a motor-based diagnosis, and 98% of those were diagnosed with DCD. Those children that had a DCD diagnosis, 89% had at least one co-occurring condition, and the most common co-occurring conditions included attentional deficit hyperactivity disorder, learning difficulties, and anxiety. Concerningly, all children in this sample were classified in the abnormal range for both emotional difficulties and peer relationships on the Strengths and Difficulties questionnaire. And this questionnaire was embedded within the Impact for DCD questionnaire. So when we looked at parent demographics, as you can see from these results, is that in this sample, there tended to be an overrepresentation of those families with more higher socioeconomic backgrounds living in urban areas of the province. So with respect to our results, we divided into 3 sections: diagnosis, rehabilitation, and school. So with regards to diagnostic services and supports, we can see that parents are identifying their children's challenges quite early at a median age of 3 years. However, it would seem that they're waiting approximately 2 years before seeking help, with a median age of 5 years. And what's also concerning is that the median age for diagnosis was 8 years old, which is quite late, given that we know early intervention is such a critical component for treating children with DCD, as it can mitigate the risks associated with those secondary consequences associated with this condition. So, the critical element here is, why are families waiting 3 to 4 years for a diagnosis? Well, families identified that there's a lack of support and resources to assist them to procure a diagnosis, and as well, there's a lack of guidance and services once they receive the diagnosis. Families identified that there's a lack of access to funded clinical assessments. And this leads families to pay for private testing, which creates an inequity in service delivery. Families also identified inconsistent awareness and understanding of DCD etiology and pathways for service amongst healthcare providers, educators, and parents themselves. And this contributes to the longer wait time. When we looked at therapy services and supports, most families had previously accessed occupational therapy, whether it was at school or in the community. However, this number drops to only 40% of children who are currently being followed by a clinician. So when we looked at some of the reasons, possible reasons why we see this drop, we did find a significant association with age and currently accessing therapy, where older children were less likely to be actively followed by a clinician. So when we looked at a little bit further, families have identified an inconsistent access and availability of school-based therapy, in addition to lack of dedicated DCD funding for therapy services, which, as their child gets older, it could potentially lead to increased financial burden, which may allude to why we're seeing this drop. Families with older children tended to prioritize services for social and emotional well-being. And those types of programs, families had a low rate of satisfaction in terms of the quality of those services. So that may also allude to why we're seeing this drop. And families also identified a low satisfaction in the amount of therapy they've received. So, which is suggesting that the current therapy access is not meeting their child's needs. When we looked at school-based services and supports, while 75% of children had received some level of support at school, whether it was curriculum adaptations or support from a resource teacher or educational assistant, families identified that there was widespread lack of awareness and understanding amongst educators on the impact DCD can have on school function. That even if a child had an IEP, implementation of those strategies and recommendations was highly dependent on the classroom teacher. And even for children to get access to the IEP was dependent on the understanding and awareness of school staff, in addition to the child having a confirmed DCD diagnosis, which we know is a challenge for families to procure. However, the eligibility for a child to get an IEP with a DCD diagnosis was also unclear. And families identified that this lack of supports and services is leading to social and emotional challenges for their children. So what are the next steps? How can we change this narrative for children with DCD and their families? Well, we know legislative changes can make significant differences. So what we plan to do is to incorporate the parent voice, results from this study, and other evidence to inform a policy brief, to advocate for funded and streamlined diagnostic pathways for DCD, to have services and supports to promote early identification and early intervention, and ensure that there is a consistent level of support and services, both at school and in the community. We also need to advocate for best practice. So we know co-op has been empirically evaluated within the literature, and that needs to be part of the standard of care. Now, as clinicians, you can help by writing and encouraging your families to write to your MLAs. We as therapists, along with our families we serve, can really advocate for change to better support the needs of children with DCD. To continue to build capacity, awareness, and advocacy, I would really encourage all of you, if you haven't yet already, to review the DCD Advocacy Toolkit. Here, there are summaries of the latest evidence for assessment, for early identification, for evidence-based intervention, as well as the assessment templates to help educate pediatricians on the diagnostic criteria for DCD. I spoke about writing letters to your MLAs. Here on this toolkit, there are letter templates that can be used to write to MLAs to advocate for change. Dr. Zwicker and her team also developed a toolkit for pediatricians, and that's available as well on the website. So I would encourage you to look at the Sunny Hill Evidence Center website for both those toolkits for the pediatricians and as well for clinicians and families. Thank you all today for your attention. I would like to acknowledge the families that participated in this study and thank them for their courage for sharing their struggles and triumphs. I also would like to thank my colleagues at Zwicker Lab for all their help and support in this study. Thank you again.